Hi everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this episode we're going to be covering the topic of what influences posture after breast cancer treatment. So if you enjoy this content and would like to see more, then please subscribe to my channel, which is completely free. Give the video a big thumbs up and leave a comment in the section below if you have any questions on what factors influence posture after breast cancer. Can I start this video off by saying thank you to everyone who is watching, commenting and subscribing on the videos. I really have to say that it's the women and the men that I get to see in my clinic every day that really inspire all of these videos and the topics that I cover. So thank you to everyone for supporting this channel. It really means so much to me. So I saw a new patient this morning in the clinic. So this particular patient has had a double mastectomy and she's noticed her posture had changed. And she said to me, is it possible that if I wore prosthetics in my bra, would it influence my posture? And I didn't have long to think about that because I knew the answer, but it also inspired this video. So there's 4 factors that I believe really influence posture after breast cancer the most. That is tension, so musculoskeletal tension, pain, energy levels, and shape change. So we're going to go through all 4 of those things. We're going to talk about why they occur, but then we're also going to talk about what you can do about each individual one of those issues so that you can improve your posture after breast cancer. Another thing I'd like to add is that a lot of people probably don't even realize that their posture's been affected after breast cancer treatment is finished or during their breast cancer treatment, because sometimes it's not the easiest thing to tell. So that's also why I firmly believe it's really important for anybody who's been diagnosed with breast cancer to be assessed at least once by a physiotherapist, occupational therapist, or exercise physiologist, because the health professionals that look after breast cancer patients on a really regular basis are going to be able to pick up the things that you may subconsciously be quite unaware of. But in saying that you're subconsciously unaware of them, what may happen down the track is those things may start to affect you. You may not be aware of what's going to affect you down the track at certain points in your experience with breast cancer, but the health professionals that deal with patients going through breast cancer or following breast cancer all the time should certainly know what's going to influence people down the track, which is why it's so important that allied health professionals are involved in breast cancer care, because it's often not the medical professionals who are focusing on these sorts of things such as posture and its influences over a longer period of time. So the first factor that can influence your posture after breast cancer is tension. So by tension, we're talking about musculoskeletal tension. Now, I've covered this topic in various videos in various ways, but what we're really honing in on here is the fact that when we talk about poor posture, we're talking about a slumped position. So from the side, you may see someone standing a little bit more in this posture. And funnily enough, that doesn't look like much, but this posture where you're caved through the upper back and your chin starting to poke forward can have big influences on things like your ability to lift your arm up in full range, so your ability to lift your shoulder into full range. It can have influences on neck mobility, neck pain, headaches, the ability to take a deep breath, and also the ability to rotate through your upper body. So even though that posture doesn't seem like much, it can have big consequences in the long term. So when we talk about musculoskeletal tension, what I'm honing in on here is the fact that if you've had any trauma from a surgical perspective, whether it's been a lumpectomy, mastectomy, breast reconstruction, even a portacath put in, your tendency is going to be to try and protect the chest wall. And so by protecting the chest wall, what do? You draw your shoulder forward. So if your shoulder is drawn forward, even subconsciously, as I said, to protect the chest wall area, it's going to tighten up this pectoralis muscle. So pectoralis major is one of the biggest muscles in your chest, that is going to pull your shoulder forward. There's also pec minor, which is on a slightly different angle, but it's also got the ability to pull that shoulder down and forward. Now, interestingly, if the muscles at the front of a shoulder are affected, the muscles at the back of your shoulder are affected. So you can become quite tight through the back of your shoulder. The other thing, of course, that's influencing this posture will be rib cage. So again, if you're slumped forward, over time, your rib cage can become stiff. And that can also give you the feeling that it's quite difficult to extend through your upper body to give yourself really good posture. So what do you do about this? Get yourself to a physiotherapist, an occupational therapist, or any medical professional that can help you by assessing your musculoskeletal posture, and obviously then going on to treat any muscle imbalances, any muscle tension, rib cage stiffness, and educate you on what is a good posture. Stretching and mobility exercises come in a big way to help musculoskeletal issues after breast cancer. So seeing a physiotherapist or occupational therapist who can prescribe the appropriate exercises is really, really important. I'll leave a link up to a couple of videos that I've done throughout this video on different stretching and mobility exercises that I believe are super important after breast cancer treatment. The second issue that's going to influence your posture after breast cancer is pain. Now, the way I explain this to a patient in the clinic today is the idea that if you're in a lot of pain, you're not going to be standing upright with your shoulders back looking really proud and feeling fantastic if you're in a lot of pain. It's more than likely you may be a little bit hunched if you are in a lot of pain. Now, of course, with breast cancer treatment, again, it's very common that the chest wall, the armpit are the areas that are getting the most affected through treatment. And so again, if you're going to protect an area, it's going to be that your shoulders will come forward, your rib cage will get rounded and over time stiff. And that's just your body trying to cope with the pain that you're in. So what to do about pain if it's influencing your posture? If it's pain that's just coming off the back of treatment such as surgery, or say if you've just finished radiation and you've got burns going on the tissue of your chest wall and you're in a lot of discomfort, this is where your medical team become important because they can prescribe pain medication. Now, not a lot of people who are going through breast cancer like adding any tablets to their current treatment regime, and I can appreciate that, but pain medication can be a means to an end. Now, as a physiotherapist, I can't prescribe pain medication, so this is why it is so important for people to have a really comprehensive medical and allied healthcare team around them, because we need different people for different things. And when it comes to prescribing pain medication, that's either going to be your GP or it might be your breast surgeon or your oncologist. So pain medication is a means to an end, but it has a really important role when it's helping you move forward through certain phases of your treatment. If you can get your pain under control, it's really going to help you improve your posture. If you can then improve your posture because you're not in pain, then exercise becomes something that is much more doable. So as you can see, controlling pain to improve your posture or improving your musculoskeletal tension to therefore improve your posture is going to have a massive flow-on effect in terms of your ability to be a really functional person. The third thing that is going to affect your posture after breast cancer is, of course, your energy levels. Now, this may not be so noticeable at the start of the day if your energy levels are better first thing in the morning, but by the end of the day, if you're really worn out, what's going to happen? You're going to find yourself slumping because you're tired. Now, particularly if you've had chemotherapy, chemotherapy accelerates muscle mass loss. So if you lose muscle, it makes it literally harder for your body to be held up against gravity during the course of the day. So that's one of the most important reasons why exercise is so important during and after breast cancer, because we're at least trying to maintain some of your muscle mass during the course of your breast cancer treatment. But then if you have lost muscle mass during breast cancer treatment, we really want you to focus on regaining that muscle mass so that you again can return to being a really functional person after your breast cancer treatment has finished. So if you notice that your posture is poor because you're just really tired, then the best antidote for low energy levels, which is influencing your posture, is exercise. The best person or the best allied health professionals you can refer yourself to is an exercise physiologist or a physiotherapist who's got experience in prescribing exercise programs for patients who have gone through breast cancer before. Interestingly, strength training is something that not all women are strongly encouraged to do during or after breast cancer, but it is something that I emphasize to my patients all the time. Because you lose muscle mass, if you're going to do exercise to try and regain that muscle mass, it's strength training that's going to give you your biggest benefits in terms of regaining muscle bulk. Now, I'm not trying to turn women into Arnold Schwarzenegger. I'm just saying that if you prefer to do cardiovascular based exercise like running, walking, swimming, bike riding, you may find that you don't regain as much muscle mass as you would have hoped. Cardiovascular styles of exercise are going to improve your muscle mass a little bit because it's still a good form of exercise, but it's more working on your cardiovascular system. And that's still a good thing. So that's not me kiboshing cardiovascular styles of exercise. I'm just saying that I think we really need to put a strong emphasis for women who are going through or following breast cancer on strength training. I think for men going through breast cancer, that there's going to be a natural tendency for them to go into a gym setting or to lift weights because that's traditionally what men have been encouraged to do or naturally do. But as far as women are concerned, historically we have not encouraged women well enough in getting into the gym and lifting weights, and I cannot emphasize this enough. So if you're finding your energy levels are poor after breast cancer and it's influencing your posture, really consider that it's possibly the muscle mass loss that's occurred during the course of treatment, and that to regain that muscle mass, which is going to help hold you up against gravity during the day, which is going to influence your posture, then get into some resistance training with a qualified health professional like a physiotherapist or an exercise physiologist. The last reason that I'm going to point out in this video as to what can influence posture after breast cancer is the significant shape change that women go through if they've had a mastectomy, particularly a double mastectomy. So if prior to your surgery you were quite used to having the shape of breasts in front of you and a little bit of a flatter stomach, once you have a double mastectomy or a single mastectomy, then as you can imagine, the shape is quite significantly different in front of you. Now, the other problem with breast cancer treatment is that weight gain is quite a common side effect. So you can go from having breast tissue in front of you with a relatively flat stomach, but then if you have a double mastectomy or a single mastectomy and then you gain weight, it's almost a shape inversion change. So you can be breast and stomach, or you can go to inverted or flat and then a bulging belly. And that can really distress quite a lot of women, particularly when they go out in public, because they are conscious, they're self-conscious of the shape change. And ultimately, if you want to hide a flat chest, what are you going to do? You're going to cave your shoulders forward and pretend that it's not there. It's almost the same concept as when there's the tall kid in the class. If they don't want to be the tall kid in the class because that's making them stand out, they're going to hunch over. So if you've had a double mastectomy and you think that the shape change that you've gone through is influencing your posture when you're going out and about, you may want to consider prosthetics. So what we mean by this is breast forms that go into your bra. So essentially an insert that goes into a bra or that's built into a bra that gives you that breast shape back. Now, I'm going to do a video with my good friend Tracy Grills, who owns Tracy G Lingerie and Prosthetics, in the near future, and we're going to go through everything on prosthetics. So watch out for that video, because if you have any questions around prostheses, we'll hopefully get them answered in that video. So if you've had a mastectomy, a single or a double mastectomy, and you notice that your posture is being influenced when you go out because of the shape change, consider one, a prosthesis. The other thing that you can consider, of course, to influence the shape of your body is a breast reconstruction. Now, that's not a small decision to be made, and it's not a decision to be made in 5 minutes. So me saying having a breast reconstruction to sort out the issue of, posture for shape change is not a quick fix by any tick of the clock. There's a lot of decisions to be made around breast reconstruction, like financial what type of breast reconstruction you're going to have, who's going to do it, the timing of the reconstruction, whether or not you have the ability to be reconstructed. All of those things come into play. But it certainly can influence someone's posture, because it is quite amazing how much more confident some women are once they have had their reconstruction performed. So reconstruction is not for everyone. It's just to make a point in this video of saying that breast reconstruction is definitely something that can influence your posture long term after breast cancer. The other thing to consider, if you've had a double mastectomy and you've put on weight during your breast cancer surgery, is to focus on weight loss, because a lot of women particularly gain weight during breast cancer treatment. And unfortunately, weight gain or the ability to lose weight after breast cancer treatment is not a topic that is heavily focused on. I certainly don't find there's a massive emphasis on helping women get to that point where they're referred to a dietitian or any sort of specialist that's going to really hone in on the fact that they've gained weight. Now, the good news is that, of all people, my brother Andrew McKenzie, who is a physiotherapist and an exercise physiologist, specialises in metabolic health and weight loss. And I am referring him a lot of my breast cancer patients, and he's doing absolutely fantastic work with this group of women to help them lose weight. Now, Andrew and I are going to do a YouTube video on weight loss in the very near future as well. So stay tuned for that video, because I'm really, really excited about that topic, because I think, again, it is underaddressed and we need so much more focus on that area. Thank you so much for watching this video, everyone. I hope you've gained some really good information on what influences posture after breast cancer. If you have any questions, please leave a comment in the section below and I'll try and get back to you as soon as possible. I hope you're having a wonderful week wherever you are. I'm Jen McKenzie, the Breast Cancer Physio, and I'll see you next time.